everyone, this is In-Law. I'm the part-time student in the HIT program. Today, my presentation is confidentiality in the healthcare setting. So the first, what is the confidentiality? Actually, the ethic principle or legal right that a physician or other health professional withhold secret or information related to a patient unless the patient gives consent permitting disclosures. Usually, all information about one's patient is confidential. This means not only their health situation, but also living situation and family situation and financial situation. As a part of the HIPAA, healthcare organizations must make sure that patients' medical information remain safe and confidential. So HIPAA, all the information about this I released here. This is individually identifiable health information. So information including demographic data that relates to the individual's past, present, or future physical or mental health or condition, the provision of health care to the individuals, the past, present, or future payment for the provision of health care to the individual, and that identifies the individual or for which there is a reasonable basis to believe can be used to identify the individual. For example, name, address, birth date, social security number, and phone number, and medical record number, and diagnosis. So there is a confidentiality breach. A breach of confidentiality is a disclosure of private information to a third party not involved with the patient's care without patient consent or court order. Disclosure can be oral or written, by telephone or fax, or electronically, for example, via email or health information networks. Accessing the medical records of patients without legitimate reason is also considered a breach of confidentiality. So there is some tips for the maintaining confidentiality. So like only view information on patients that you are directly providing care to. Like after view confidential information on the computer, log off so others cannot view the information. And avoid discussion of patient's care in non-private area. Like for example, like elevator, hallway, or cafeteria. And be careful of what you saw away. Personal health information should never be disposed of the trash can. Any document thrown in the trash is open to the public and therefore a breach of information. Sometimes you should think before you speak. What you are about to say confidential. If so, is the person you are speaking to part of the patient's healthcare team like this? So we should always be careful. So for the whole presentation, in conclusion, it is imperative that as healthcare professionals, we maintain our patients' confidentiality at all times. This not only protects our patients, but ourselves. So there is a reference I use in this presentation. I did a lot of search and learn a lot from this topic. So hope you can learn something from my presentation too. Thank you so much.